Here we go. Hello, everyone. Welcome to another episode of The Way of the Movement Professionals. This is where I get to talk to physical therapists from across the country and learn about their past, present, and future. So today, I'm delighted to spend some time talking to one of my mentors, Dr. Suzy Cornbleet. She's an associate professor of physical therapy and orthopedic surgery at Washington University in St. Louis. And I've been very lucky to have learned from Suzy since I was a student at WashU. And it's wonderful to be able to continue working with her even after all these years. So Suzy, thank you for joining me today.
Certainly.
Awesome.
It's
So
gonna be fun.
yeah, it's gonna be fun.
Kind word, Michael.
So first off, what do you teach at the program in physical therapy at Washington University?
So I'm involved in many of the clinically oriented courses, the hands-on skills, the basic skills, and then some of the higher level skills with the movement system impairment diagnosis courses, or the content related to that. But at the beginning, in the first year, I teach manual muscle testing to the students, that's one of the biggest things in the first year, along with just general palpation, sort of functional anatomy skills. And then that's followed up by starting to teach them the beginnings of the systematic exam for our movement system impairment exam. And then in the later courses, I teach in the higher level clinical reasoning for the diagnosis and management of movement problems kinds of content. And then I also coordinate a couple, courses. So one of them is a huge course in the last semester that I'm currently working on right now that allows the students to have all kinds of clinical experiences after they come back from their final rotation, and they're spending their last semester here. So that's kind of what I teach. I used to be a big part of our fellowship program in movement system impairments, which has currently been closed down. So we don't have that right now. And then I also teach in the clinic with some of the younger and some of the seasoned therapists there. We have like a collaboration mentorship program. So
you have your hands on everything from early on in the DPT program all the way to the end, as well as the clinical aspect of things.
And then clinical education as well. That's a huge part of what I do. So since I've been here for over 40 years, I've been in the clinical education program. So we counsel all the students related to their clinical experiences, and then manage the whole time that they are out on their experiences too.
Mm-hmm. I remember it was such a relief to see you during one of my clinical rotations to have my teachers come out and visit us on site. Not that I wasn't having a great time, I was having a good time at the clinic site, but just to see that familiar face and being reassured and all of that. So
yeah, that's really nice. And we still try to do that, although with COVID, it's been cut down quite a bit. But yeah, we still do visits to the students when they're out in the clinic. Mm-hmm.
Now, going back to a little while ago, how did you first decide to become a physical therapist?
Well, I was in 7th grade, I think I was in 7th grade. My father was a doctor, and I knew I wanted to do something in the health field. But we had a program at school where we could, maybe it was 9th grade, I'm really confused now, but where we could go out into the community and volunteer. So I went to a county hospital here in St. Louis, and I worked in the physical therapy department. And I'll never forget, one of my first patients was a bilateral amputee. And I just I fell in love with it. I fell in love with it at that early age. And so then my whole planning on where I was going to go to university or college was based on where I wanted to try to get into physical therapy school. And I ended up going to Colorado, University of Colorado, and got accepted into their small little program that they had at that time. And yeah, so that was the turning point for me. And it's been like that the whole way. I just always have loved it and never looked back, never regretted my decision at all, because it's such a wonderful, wonderful career profession to be in. And I've had many different experiences over the years. So we started off in, my love was for neuro rehab. So I was working with spinal cord injured patients and patients with stroke and traumatic brain injury, that sort of thing. And then I left that facility and I started having some children and did home health for a year, and then got associated with Washington University early on, just teaching a little bit in their spinal cord injury course and working in clinical education. And that's how I got involved with Washington University back in like 1981 or something like that.
Nice. So kind of looking through your career, there must be a bunch of people who influenced you in your career, and I wondered who might those people be.
Probably my father was one of my earliest influences, just because of the type of physician that he was. He was an internist, and he was just such a giving person and treated a lot of his patients for free because they couldn't afford to pay. And then, so that was kind of my interest in getting involved in something related to medical care. And then, honestly, since I've been here for so long, and I'm not just saying this to butter up or whatever, but Dr. Simon really has been the biggest influence for me in my career. And I'd have to say that when I came to Washington University, I had a total dislike for musculoskeletal physical therapy. I really like neuro. That's, because at the facility where I was, we treated every patient the same, every orthopedic patient the same. And I never knew why I was doing anything. Every back patient got the same set of exercises. Everybody got that one kind of treatment. There was no rationale. When I came to Washington University and started working with Shirley and the rest of the faculty here, it changed my whole outlook on musculoskeletal physical therapy. I had done peds before, I had done neuro, I had done acute care, which I did not really like that much. And I had no desire to do orthopedics until I started working with the faculty here. And then learning a system that made sense to me based on anatomy, kinesiology. I felt like now I could really, it was like a puzzle. It was sort of like working with neurological patients, because I could look at each patient, kind of really systematically figure out their problem and put a name to it, a diagnosis to it or whatever. And then I knew how to treat, and I didn't have to come up with weird kinds of treatments, because it all just made total sense to me. So that really changed how I felt about physical therapy. And I've been doing musculoskeletal PT most of the time that I've been here, and loving it because of the movement system impairments. And that's why I wanted to be a part of the team here at Washington University that's been developing the content and teaching it in school here, and also in other places around the country and the world. And, I just don't know how people treat otherwise, without having this kind of a system, some sort of a system to really figure things out.
Yeah, that's great to to hear about your history of what type of patients that you saw early on. And nowadays, are there specific areas of interest or patient population that you have, because I know you work with a lot of ortho patients, and what drew you to those kinds of population?
Well, like I said, I think once I got here, I started thinking that orthopedic or musculoskeletal pain problems became much more interesting to me. And that's kind of what drew, because of being able to do the exam, the way we teach our students, and the way, that from what Shirley has started here, what Dr. Simon has started, it really gave me a whole new perspective on that aspect of physical therapy. And I still love spinal cord injury and things like that, but this has been really challenging for me and fun, trying to figure out people's problems and why they have pain problems. And within that area of musculoskeletal, I really love the hip. I think that's one area that I feel like what we do here about teaching about the hip is very different from what maybe other schools and programs teach. And I just find it fascinating. I love to figure those problems out. So, hip, low back, shoulder, neck kind of things. I kind of stay away from hand, foot. Not that I can't do it, but it's just not a huge interest of mine that much. But most other areas are. But I really enjoy what I've learned about the hip, and like to teach it. Teach that information too.
Yeah,
So.
and you were a chapter contributor to the second MSI textbook, Suzy. Yes.
And the knee, yeah, for the knee, because we had other people doing the hip at the time, and but I like the knee too, but it's just not as interesting as the hip or the back or the shoulder or the neck.
Oh,
So,
good. As Shirley would say, the knee only goes like
the
this.
knee only does that, and it's just kind of right.
Well, and Suzy, just to getting to know your personal life a little bit, are you currently into any hobbies or any specific mode of exercises?
Oh yeah, I have my new reason for living right now outside of physical therapy is pickleball. So I am an avid pickleball player, which started right around the time of right before COVID. So it's been maybe 3 or 4 years. I play average about 3 times a week, and yeah, and it is so much fun, and it has given me a lot of new friends, much more social activity than I've ever had before. And so even as old as I am right now, I'm feeling for the most part better about everything, because I have that as an outlet. Other than that, I walk a lot, and then I'm a water skier, but I haven't been doing a whole lot of that in my last few years. But I've been a water skier, trick skier, and different kinds of water skiing since I was a little kid. So those are kind of used to play tennis too, but not like you, Michael. I haven't played. I played in my younger years, but I never played much as I got, in my adult years. I slowed down a little bit. But I think that's why I like pickleball so much.
Yeah, pickleball is just taking the
off.
whole US. I mean, I think every person I know is like getting into it. They're so excited about it. It's a fun game. Yeah.
It is a really fun game, and not as serious, I think, as sometimes as tennis kind of seems to me. So it's a little bit more laughing and joking and all that kind of stuff. So I really like it.
Yeah, very good. And now this is January 2023, so we are just starting a brand new year. Do you have any goals specific for this year?
Personal or professional?
Oh, either. I'd love to hear either.
Personal is just to stay healthy and continue to play pickleball and spend more time with my family, who are all out in San Diego. So I just don't get to see them enough. My twin grandsons are now 11 years old as of a couple days ago. And pretty soon they're not even going to want to hang out with their Susu and JJ, their grandparents, because they're getting to be teens almost. So that would be some personal goals. Professionally, I mean, right now we're in the middle of a curriculum renewal change. It's a huge project, and I'm just trying to survive at this point and do the best that we can for the students learning. You know, I just want to continue to promote the movement system in any way I can, and kind of keep doing what I'm doing. You know, I don't really have a whole lot of new goals at this time, because I'm getting closer to the end of my career than the beginning of my career. So
I'm pretty sure you're doing more than just surviving. I always felt, and this is just, I think overall the culture of the faculty, that you guys have always been super open and super kind and thoughtful for the students, what we're going through, even though you guys are probably going through so much more than we were, and always there for us to help us learn the materials. And so despite this new curriculum and everybody's super busy, but I don't think you're just surviving.
No,
I think
probably not.
Are really appreciative.
The moments feel like that, but no, we're trying to make it really, really, really good. And the whole thing with COVID has been very challenging. It's been harder we have a huge class, we have 94 in our third year class and like 80, high 80s. And it's so with masks on and everything, it's been more challenging to get to know students compared to when you were there. Just because we can't see their faces. Now, right now, we're just starting to unmask, and it'll be a little bit different, hopefully. But COVID has brought a lot of challenges in teaching across the country and across the world, I'm sure. So it's been an interesting new challenge for all of us to try to figure out how to make it the best that we can.
Yeah. Yeah, speaking of the different ways of learning too, I've been doing the Movement System Monthly, where I go live every month to share something about the movement system with my Japanese community.
That's wonderful.
So early next month, you'll be my guest speaker for the Movement System Monthly.
Thank you for inviting me.
I know, well, and the reason is I so enjoyed your lecture on the abdominals topic that you did for last year's advanced upper quarter MSI course, that I wanted the Japanese community to hear about that. I thought it was so well done. So we're really looking forward to learning from you in February.
I'm looking forward to it too. I'll be anxious to meet everybody on Zoom and present that material. So I appreciate you inviting me, Michael.
Well, we will see you in a few weeks, and thank you so much for your time, Suzy.
Of course. Thank you for having me, and I look forward to the sessions that are coming up. Bye-bye.
Hey everyone, how did you enjoy getting to know Dr. Suzy Cornbleet? I sure did, and as many years as I've known her, there were still a couple new things that I learned about her. If you guys enjoy this sort of short interviews with different physical therapists and movement professionals, please hit the like button and be sure to subscribe to this channel. That helps out a lot. And maybe even in the comments, let me know who you would like me to interview next. And if I know that person and can get in touch with them, I'll do my best. See you next time.